I'll have to say this grant may have the longest title of any grant that's ever been granted by the National Cancer Institute, the Gulf South Minority Underserved NCI Community Oncology Research Program.
The title of the grant may be long, but it will now give doctors at the Louisiana Cancer Research Center more time and resources to launch a first-of-its-kind cancer research prevention and treatment center in the New Orleans area. City leaders, state leaders, and physicians from all across the state were on hand for the announcement.
The research does exactly what it's supposed to do, which is to improve not only the quality of life, but the length of life as well.
Dr. Augusto Ochoa, the director of the LSU Health Sciences Center Stanley Scott Cancer Center, wrote and submitted the grant. He says this grant will lead to better treatments for patients all throughout the biomedical corridor.
The discoveries that are being made here are being translated in the hospital down the street and will soon be translated into new treatments and new diagnostics in the state-of-the-art hospitals that are being built across the street and will soon be open.
The National Cancer Institute awarded a total of 53 new 5-year grants, which were broken down into 3 categories: 7 research bases, 34 community sites, and 12 minority and underserved community sites. Ochsner was one of 34 community sites to receive a grant, while LSU was one of 12 minority and underserved sites to receive a grant from the National Cancer Institute. The funding will help improve cancer prevention and treatment through precision and personalized medicine.
The treatment of the patients is done and is led by the genetic mapping of their tumors and not simply by receiving the same drug as everybody else.
This is with no HIV or anything. This is a normal nucleus.
An example of that would be studying cells in patients with HIV. Ferdos Kadri, a MB-PH student at LSU studying cells, says patients without the disease have normal, regulated cell cycles with a mixture of red and green colored proteins. But patients with HIV may have a strong concentration of the green colored protein and less of the red protein. He says that dysregulation of the cell cycle can lead to many different types of cancer in those patients.
Many of the HIV patients actually get, lymphoma. They come up with Kaposi sarcoma as well.
Dr. Ochoa says that in the 1970s, treating cancer was limited to only 2 major tools available to doctors: surgery and radiation. But pioneering physicians and researchers discovered genetic changes to lead to new ways to treat patients.
Now have state-of-the-art therapies that will allow us to treat patients here today.
The funding will give doctors the opportunity to go further in searching for a cure for cancer.